Dr. Amelia Washington wasn't just traveling to Los Angeles that day for a routine medical conference, but when a passenger's stroke turned Flight 628 into a neurological emergency, 219 people witnessed transit. Dr. Amelia Washington settled into her first-class seat aboard United Flight 628 from Boston to Los Angeles, with the focused concentration and professional dedication of someone who had spent 24 extraordinary years mastering the most complex mysteries of the human brain, performing intricate neurosurgical procedures, and developing groundbreaking treatment protocols that had revolutionized neurological medicine at some of the world's most prestigious medical institutions. At 51 years old, she carried herself with the composed authority and intellectual precision that comes from accumulating over 18,000 hours of neurosurgical experience, completing advanced fellowships in cerebrovascular surgery and stroke intervention, and developing specialized expertise in emergency neurological care that had made her a foremost specialist for the most complex brain conditions that other physicians often considered beyond conventional treatment options and surgical intervention. Her impressive credentials included board certifications in neurosurgery and neurology, fellowship training from Harvard Medical School and Mayo Clinic, and numerous professional achievements that qualified her to handle everything from routine neurological consultations to emergency life-saving interventions involving strokes, brain aneurysms, and complex neurological emergencies that required immediate medical intervention and precise clinical decision-making within critical time windows that often determined patient survival and recovery outcomes. Today's flight was taking her to the prestigious International Stroke Conference, where she was scheduled to present her latest research on revolutionary stroke treatment protocols that had successfully reduced permanent neurological damage by 60% through innovative early intervention techniques that she had personally developed during her distinguished tenure as Chief of Neurosurgery and Director of Stroke Services at Massachusetts General Hospital in Boston. Her understated black blazer and professional appearance reflected her personal preference for quiet competence rather than obvious displays of status or authority, though her extensive neurological knowledge and surgical expertise represented decades of rigorous training and practical experience that had saved hundreds of lives through precise diagnosis and expert treatment of complex brain conditions requiring split-second decision-making and advanced medical intervention. Flight attendant Rachel Morrison, a senior crew member with 7 years of airline experience, who had developed certain assumptions about passenger capabilities and medical expertise based on superficial observations rather than actual qualifications or professional credentials, observed Amelia's quiet demeanor and modest presentation without recognizing the intense intellectual focus and clinical precision that characterized someone who regularly made life-and-death decisions involving the most delicate and complex organ in the human body. Approximately 2 hours into the flight, as the Boeing 777 cruised smoothly at cruising altitude over the Colorado Rockies, passenger Margaret Thompson, a 72-year-old retired teacher traveling to visit her beloved grandchildren in California, suddenly experienced the unmistakable onset of a massive stroke as she attempted to reach for her reading glasses, her left arm becoming completely paralyzed while her face drooped dramatically on one side, and her speech became severely slurred and increasingly incomprehensible in a rapidly progressing neurological emergency that required immediate expert medical intervention within a critical time window to prevent permanent brain damage and potential death. "Something's terribly wrong," Thompson managed to mumble through severely impaired speech, as classic stroke symptoms developed with frightening speed and clinical precision, creating a neurological crisis that demanded immediate professional assessment and emergency treatment within the first few precious minutes, when vulnerable brain tissue could still be saved through appropriate medical intervention and proper stroke protocols. Her alarming condition deteriorated rapidly as additional stroke symptoms manifested with textbook precision that any experienced neurologist would immediately recognize as a large vessel occlusion requiring immediate expert intervention, her right side facial paralysis becoming increasingly pronounced, while her left arm remained completely unresponsive, and her ability to speak coherently continued to decline significantly with each passing minute. Morrison responded to the urgent medical emergency call with standard airline protocols, approaching the visibly distressed passenger with basic first aid training, but completely inadequate medical knowledge for managing complex neurological emergencies that required specialized expertise and immediate clinical decision-making within narrow time windows that directly determined patient outcomes. Please try to remain calm while we carefully assess your medical situation, Morrison said with obvious uncertainty and growing concern, observing symptoms that clearly indicated a serious neurological emergency beyond her training and comprehension. Amelia immediately recognized the classic presentation of acute stroke and instinctively moved toward the unfolding medical emergency. Her extensive professional training and decades of specialized experience automatically engaging as she quickly assessed the critical situation that required immediate neurological intervention to prevent irreversible brain damage. I'm a neurosurgeon and neurologist, and this passenger is having a severe stroke requiring immediate medical attention within minutes to prevent permanent brain damage, she said professionally, with medical authority and clinical urgency. Morrison looked at Amelia with immediate skepticism and dismissive assessment, taking in her modest appearance while making prejudiced assumptions about her qualifications based on stereotypical expectations. We appreciate your concern, but we have trained personnel and established protocols for medical situations, Morrison replied condescendingly, believing someone of Amelia's appearance couldn't possess the neurological expertise necessary for managing serious brain emergencies. As Thompson's condition deteriorated with progressing symptoms, indicating large vessel occlusion requiring intervention within the critical 3-hour window for brain tissue preservation, Amelia persisted in providing life-saving care despite systematic dismissal from airline personnel who refused acknowledging her expertise based on superficial judgments about appearance and limited understanding of neurological emergencies. This passenger is experiencing large vessel stroke requiring immediate neurological assessment and intervention, she explained with professional urgency that should have established her credibility. Every minute of delay increases permanent brain damage and reduces possibility of meaningful recovery. Morrison continued discriminatory resistance, prioritizing her authority over passenger safety and emergency care that could determine whether Thompson survived with functional recovery or suffered permanent disability. I told you we have appropriate procedures, and I need you to return to your seat immediately, she insisted with hostility demonstrating complete lack of understanding about neurological priorities operating within narrow time windows. Other flight attendants supported Morrison's dismissive approach, creating systematic medical discrimination, preventing qualified intervention during critical situations where every minute dramatically increased risk of permanent damage, disability, or death. Amelia observed with alarm how crew prejudices directly interfered with emergency care that could save Thompson's brain function, though she remained committed to providing assistance despite discriminatory obstacles from personnel prioritizing control over acknowledging expertise. Stroke is time-dependent emergency, she continued with calm authority. This passenger's symptoms indicate large vessel occlusion requiring immediate intervention to prevent irreversible damage. Other passengers witnessed the conflict between Amelia's knowledge and crew's refusal to accept her expertise, expressing confusion about why qualified medical help was rejected during a serious emergency, visibly worsening each minute. As Thompson's stroke worsened with symptoms progressing toward complete compromise, her speech became unintelligible, paralysis extended to her leg, and consciousness declined in patterns any neurologist would recognize as expanding brain infarction, requiring immediate intervention to prevent fatal complications. "Please help my mother," pleaded Thompson's daughter Susan, becoming frantic witnessing her mother's distress and the crew's inability to provide adequate care for the life-threatening emergency. "She's getting worse and they don't understand what's happening." Amelia continued attempts to provide life-saving intervention despite systematic obstruction from personnel more concerned with maintaining authority than ensuring safety and appropriate emergency response. "This patient is developing massive stroke with expanding brain infarction," she explained with clinical precision that should have established her credibility. "Without immediate intervention, she will suffer permanent disability or death from brain tissue death." More passengers expressed concern about the situation, questioning why the crew refused medical assistance from someone who clearly possessed neurological knowledge for managing stroke emergencies. "Why won't they let the neurologist help?" asked one passenger loudly. "Can't they see that woman is having a stroke while they argue about procedures?" Dr. Robert Chen, a cardiologist in business class observing with growing alarm, approached with worry about patient safety and the crew's inappropriate response to qualified assistance during critical brain emergency. "Rachel, this woman is absolutely correct in her assessment, and I can confirm this passenger is having severe stroke requiring immediate medical intervention," he said, using her name tag. Morrison responded defensively, her explanation revealing stubborn adherence to discriminatory assumptions and dangerous prioritization of authority over passenger safety during life-threatening emergency requiring immediate brain medicine. Thompson's stroke reached irreversible threshold as symptoms progressed to severe brain compromise with complete paralysis, speech loss, and declining consciousness, indicating massive brain tissue death occurring while crew resistance to qualified assistance created tragic situations where institutional prejudice directly contributed to preventable damage and potential death. Her pupils are becoming unequal, indicating increased intracranial pressure from brain swelling, Amelia announced with professional urgency, observing classic progression of massive stroke toward potentially fatal complications, requiring immediate intervention. Without neurological intervention, this passenger will likely die from brain herniation within 30 minutes. The gravity of her assessment began penetrating awareness of surrounding passengers and crew members who started understanding they might be witnessing preventable death due to systematic refusal to accept qualified expertise. Chen stepped forward, adding his professional voice to urgent need for immediate intervention. "I can confirm Dr. Washington's assessment is absolutely accurate," he announced with medical authority. "This passenger is dying from stroke, and we need to allow this neurologist to provide emergency medicine immediately." Despite mounting evidence and endorsement, Morrison maintained resistance with stubborn adherence to discriminatory assumptions. "We appreciate your opinions, but we have established protocols that don't involve turning control over to passengers who may not have appropriate credentials," she replied defensively, demonstrating continued prioritization of institutional control over safety. Amelia watched with horror as Thompson's condition deteriorated beyond meaningful recovery, understanding the critical window was closing while precious brain tissue died from lack of blood flow. "We are now past optimal window for intervention," she explained with clinical authority while witnessing irreversible damage occurring. "This passenger has likely suffered permanent severe damage that could have been minimized with immediate intervention." As Thompson's condition progressed to complete stroke with massive brain infarction and unconsciousness, indicating the critical window had passed and irreversible damage occurred due to delayed care. The crew finally understood their mistake and tragic consequences of refusing qualified expertise during time-sensitive emergency. "Oh my God, what have we done?" Morrison whispered with horror, witnessing Thompson's neurological collapse and understanding their refusal had directly contributed to this outcome. Chen approached Amelia with professional respect and growing awareness of the expertise systematically excluded based on discriminatory assumptions about qualifications. "Dr. Washington, I want to acknowledge your neurological expertise and the tragic loss due to the crew's refusal to accept your qualified assistance during this critical emergency," he said, with genuine admiration. Amelia focused on Thompson's condition with continued dedication, despite futility at this advanced stage, providing what comfort and assessment she could while grieving the preventable tragedy that unfolded due to systematic discrimination. "This patient has suffered massive stroke with complete brain infarction," she explained with clinical precision while checking for remaining function. "The delay has resulted in irreversible damage, likely leaving her in permanent vegetative state with minimal possibility of recovery." Morrison finally approached with remorse and belated recognition of her catastrophic misjudgment contributing to Thompson's tragic outcome. "Dr. Washington, I need to know who you are so I can understand the magnitude of what we've done by refusing your expertise," she said with contrition. Other passengers gathered with concern and growing awareness they had witnessed preventable tragedy occurring due to discrimination against qualified expertise during critical emergency. Flight Supervisor Rodriguez, learning about the situation, approached with alarm about the crisis and its outcome. "What is the medical situation, and what expertise was available that we failed to utilize?" he asked, with growing concern about liability. As the full scope of tragedy became apparent with Thompson unconscious from irreversible brain damage, Chen stepped forward, providing crew and passengers complete understanding of the neurological expertise systematically excluded based on discriminatory assumptions about qualifications. "Everyone needs to understand that Dr. Amelia Washington is one of the world's leading neurosurgeons and stroke specialists, chief of neurosurgery at Massachusetts General Hospital, whose expertise could have prevented this outcome if she had been allowed to provide immediate intervention during the critical window," he announced with professional gravity. The revelation created immediate shock among all personnel and passengers who understood they had witnessed preventable catastrophe occurring due to systematic refusal to accept world-class expertise from someone whose qualifications represented the highest standards of brain medicine. Morrison stood frozen with complete devastation, realizing her discriminatory behavior had directly contributed to permanent disability and loss of brain function that could have been prevented with immediate intervention. "Dr. Washington, I need to understand your qualifications so we can comprehend the magnitude of this tragedy and our failure to utilize available expertise," Rodriguez said with institutional shame. Amelia continued monitoring Thompson's status while providing clear understanding of the expertise excluded from response. "I am Chief of Neurosurgery and Director of Stroke Services at Massachusetts General Hospital with 24 years of experience in emergency stroke intervention, and I could have provided immediate care that might have preserved this patient's brain function and prevented permanent disability," she explained with quiet authority. The weight of her credentials and tragic irony created profound impact as everyone understood one of the world's leading stroke experts had been prevented from providing life-saving care during critical emergency. Chen continued with professional respect. "Dr. Washington has pioneered stroke intervention techniques, used worldwide, and saved thousands of patients through her innovative protocols and surgical expertise." Thompson's daughter Susan, finally understanding what occurred, approached Amelia with tears of grief and regret. "Are you saying my mother could have been saved if they had let you help immediately?" she asked with anguish about discriminatory treatment that cost her mother's neurological function. As emergency personnel prepared to receive the aircraft for medical evacuation, the complete scope of Dr. Washington's qualifications became apparent to everyone on board as they learned about expertise systematically excluded from response, resulting in preventable tragedy that could have been avoided with immediate intervention. Dr. Amelia Washington is recognized internationally as one of the world's foremost authorities on emergency stroke intervention and neurosurgical care, whose research and expertise have revolutionized brain medicine and saved countless lives through innovative treatment protocols, announced Captain Martinez over the intercom with professional grief. The announcement created profound impact among all passengers who understood they had witnessed preventable catastrophe occurring due to discrimination against world-class expertise during critical emergency. Morrison approached Amelia with professional devastation about her role in the outcome. "Dr. Washington, I cannot express the depth of my regret for my discriminatory behavior and refusal to recognize your expertise. My prejudiced assumptions have directly contributed to this patient's permanent disability," she said with genuine remorse. Amelia continued providing what assessment and comfort she could, while graciously accepting belated recognition and passenger sympathy for tragic circumstances preventing optimal care. The most tragic aspect is that immediate stroke intervention could have preserved Mrs. Thompson's brain function and prevented permanent damage. Stroke is entirely time-dependent, and the delay has resulted in irreversible consequences that could have been avoided with immediate intervention, she replied with characteristic composure, despite grief about the preventable outcome. Chen provided additional context about Amelia's qualifications and international recognition that made the tragic outcome even more devastating. Dr. Washington has published over 200 research papers on stroke intervention, developed treatment protocols used worldwide, and has been recognized with every major award in neurosurgery for her contributions to brain health, he explained with professional admiration. The passengers began expressing grief and anger about discriminatory treatment preventing world-class intervention during critical emergency, understanding they had witnessed preventable tragedy that would forever change their understanding of prejudice consequences in medical emergencies. When emergency personnel confirmed Thompson had suffered massive stroke with irreversible brain damage due to delayed intervention, the full scope of tragedy and its preventable nature became apparent to everyone as they recognized the correlation between discrimination and catastrophic outcomes that could have been avoided with immediate neurological care. This patient has suffered complete brain infarction with minimal function remaining. The extent of damage indicates intervention was delayed well beyond the critical window for stroke treatment, announced emergency medical technician Rodriguez upon boarding. The confirmation created immediate understanding about tragic consequences of refusing qualified expertise during critical emergency, where every minute contributed to irreversible brain tissue death. Thompson's daughter Susan confronted Morrison and crew with justifiable anger about discriminatory behavior that contributed to her mother's permanent disability. "You killed my mother's brain because you couldn't believe that a black woman could be a world-renowned neurosurgeon. Your prejudice has destroyed her life and condemned her to permanent disability that could have been prevented," she said, with anguish and rage. Morrison found herself unable to respond to the devastating accuracy of Susan's assessment. Understanding her discriminatory assumptions and systematic refusal had directly contributed to preventable catastrophe. Amelia continued providing medical consultation while supporting Thompson's family through tragic circumstances resulting from discrimination against her expertise. I want the family to understand that Mrs. Thompson received the best possible care once intervention began. While the damage is extensive, we will ensure she receives optimal supportive care and rehabilitation to maximize whatever recovery potential remains, she said with professional compassion, despite limitations imposed by delayed treatment. Captain Martinez made an additional announcement acknowledging airline responsibility for the tragic outcome and discrimination preventing appropriate response. I want to personally acknowledge that our crew's failure to recognize and utilize Dr. Washington's world-class expertise has resulted in preventable tragedy that will forever change how we respond to medical emergencies and recognize qualifications regardless of personal assumptions. This is why truth always comes to light, and justice always finds its way. If this story shows you that dignity and respect matter more than assumptions, make sure you subscribe to see more stories where justice prevails. Because when we stand together against discrimination, we make real change happen. Following the devastating tragedy and evidence of how discriminatory assumptions had directly contributed to preventable brain damage and permanent disability during medical emergency, United Airlines immediately initiated comprehensive reforms to crew training programs, medical emergency protocols, and discrimination prevention procedures, ensuring immediate recognition and utilization of qualified medical professionals during emergencies, while eliminating prejudiced judgments compromising patient safety. Morrison was immediately terminated and faced personal liability for her role in discriminatory treatment contributing to Thompson's permanent disability. While all airline personnel were required to complete extensive diversity training and medical emergency education emphasizing the critical importance of recognizing medical expertise, regardless of demographic characteristics or assumptions about professional qualifications. The incident became a landmark case in aviation medicine and medical discrimination as Thompson's family pursued legal action, resulting in significant financial settlements and industry-wide changes to emergency protocols, preventing similar tragedies and ensuring appropriate recognition of expertise during critical situations where outcomes depended on immediate intervention. Amelia's involvement and professional testimony about the preventable nature of Thompson's damage became a catalyst for nationwide discussions about discrimination in emergency care and tragic consequences of refusing qualified assistance based on prejudiced assumptions and stereotypical expectations about medical professionals. Within months, Margaret Thompson remained in persistent vegetative state with minimal neurological function, serving as permanent reminder of devastating consequences of discrimination against medical expertise during critical emergencies where brain tissue preservation depended on immediate intervention and appropriate stroke protocols. The transformation extended beyond individual airline policies to influence broader conversations about discrimination in emergency medical care. The importance of recognizing professional expertise regardless of demographic characteristics, and critical need for institutional changes, ensuring optimal medical response during emergency situations, determining life and death outcomes for patients, depending on immediate neurological intervention. Medical organizations and aviation safety agencies used Thompson's case as a powerful example of how discrimination could result in preventable tragedies and developed comprehensive training programs, ensuring appropriate recognition of medical expertise during critical situations, regardless of personal biases or stereotypical assumptions. Dr. Washington's experience became tragic but important example of how prejudice could directly contribute to preventable outcomes, while highlighting critical importance of recognizing and utilizing medical expertise during emergencies where patient survival and neurological function depended on immediate intervention and appropriate clinical decision-making. But Dr. Washington's story is just one example of how prejudice can have devastating consequences in critical moments. Next video. Watch what happens when a Black hospital CEO's 12-year secret is revealed during an airport medical crisis. When staff refuse her authority over patient care, the most shocking healthcare credentials in administrative history emerge. You won't believe what happens when medical power meets institutional bias. If you enjoyed this video, please subscribe and turn on notifications for new content. Don't forget to hit the like button if this story moved you, and share your thoughts and opinions about this situation in the comments below.